So in terms of medications, what we have in Canada, we have 3 medications to offer. And the criteria of this medication is that anyone who has a higher BMI above 30, we can put on them. And then anyone who are overweight. In fact, South Asians, the BMI has changed now. So South Asians can have more risk of obesity. So that has been changed. So anyone who has a BMI of 27 with any one of the complications, we can start them on medication. So these are Health Canada approved medications, just like high blood pressure, diabetes. So the first in line, we have what we call as good hormones. So you remember I talked about the good hormones. Are you guys with me? Do you guys need coffee? Because I'm feeling very.
No, I'm here.
Okay. Yeah. Who wants to grab a coffee? So as I told you, good hormone. So what we did, we actually made this good hormone in the lab. Just like insulin, people with diabetes, they didn't have insulin. What did we do? We went in the lab and we created the insulin. We gave them insulin. So for obesity, we went and we created that in the lab. So we give them the good hormone. So what does the good hormone does, ladies? Give you a sense of fullness.
It gives you the feeling of fullness,
less craving, and
less cravings,
and whatever your metabolism is.
Yeah.
So I would not call it the increase in metabolism. Whatever your metabolism is, whatever, what your age, sex, physical activity, it gives you. Because the issue with postmenopausal women is that it just puts them down. Postpartum, your metabolism goes down. So whatever you're doing physically, it just do the justice. Let's put it that way. Okay. So that's what we have. So Saxenda and Ozempic are same class of drugs. The only difference is that the Saxenda is an injection, which is a daily injection in your belly. Ozempic is a weekly injection in your belly or in your arms or in your thighs. Okay. And 98% of my practice are either one of the injection, depending what's covered or not. The second medication, I'll talk about the side effects in a minute. The second medication is called by Contrave. This is a pill. What does Contrave does? It does reduces appetite at the level of the set point, hypothalamus, but at the same time, it disassociates the pleasure. You know that the carb addiction, oh, Dr. Khan, I cannot give up my nighttime eating snack habits. You know, I have to have it. So that's sort of an addiction, carb addiction. It works on the craving center, disassociates it. So this Contrave actually can be used for smoking cessation, alcohol cessation, marijuana cessation, carbohydrate cessation, because disassociate the pleasure. And it is a good anti-anxiety and antidepressant drug. So people who are very stressful eaters, works very well. The third drug, which I have seldomly used, we used to use it years ago. This is basically don't let the fat that you're taking absorb. So if you say, hey doc, I cannot give up my McDonald's and Popeye meal, okay, take this. So you take this and you will poop it out all the fat. The problem with most of the people is that they're eating healthy. So it actually does not work. It does not have no influence on your hunger, craving, right? So we don't use that medication, but I just want to tell you that Zeneca or Orlistat is still an option. Moving forward with side effects or how much time we are looking into it. So I would say minimum 6 months, because it's a chronic disease. 6 months we can decide. I mean, the literature shows you can be on it for 5, 6, 7 years. We have literature on both weight maintenance and weight loss, because some people will still have struggle with weight maintenance. Usually when we are initiating therapy, I would say that have a mind of 6 months in your mind. So most common side effect in all of these 3 medications that I'm talking about is nausea, cramp, abdominal pain, constipation, diarrhea. So these 3 that I've talked, these are every second person will have it. There is no excuse on that. Heartburn is another one. Very less might have some headache and nausea with it. Some people have nausea, but it does get better. And then the rare one in Saxenda is usually, actually I have to add it, it's gallstone formation. And in Contrave, I have to see what medications you're on, because there's a lot of drug-to-drug interaction with it. So that's why I will do a customized approach to you. Do you have any questions on that? So the most common is GI upset, nausea, cramps, diarrhea, constipation. Less common, insomnia, kind of anxiety provocation. That's about it. in Saxenda or Ozempic gallstone formation? Question?
I'm sorry, Dr. Saima, I got disconnected. So
Yeah, I
I
was
just
talking about the side
rejoined.
effects. I was just
Yeah,
talking about the,
I missed, I think.
yeah, so I was telling the most common with all of these drugs are nausea. Every second person will have nausea. And then every time we're increasing the dose, you might have nausea, but it settles down quite easily. Diarrhea, constipation, heartburn, crampy abdomen. Anytime we initiate or we increase the dose, that's what happens. But third, fourth days get better. So you would have dose initiated, 3 days kind of rough, 4 days good. Then we decide to increase the dose because we have to go to the therapeutic dose. This would happen. The less common is usually initially restless night, bit often you would say that anxiety, palpitation, something like that, but it does settle down. Very less common. I haven't heard many. This, and with Saxenda and Ozempic, the rare that I always make sure that my patient understand is formation of gallstones, and you can have you might have to have got your gallstones out. If you don't have gallbladder, you're lucky. Questions?
So if you already have gallstones.
Yes, so if you already have gallstones, then we have to be very cautious because it can provoke the attack. Usually there is a certain dose that when you start to feel sort of a biliary colic or pain, then we have to be cautious. So this is something that we both need to sit down and work it out individually. But yes, it can provoke an attack for sure. It's not contraindicated though, but this is something we have to mind. And then it happens, then get it out and restart again.
Okay.
Now, in terms of coverage, so I mean, most of the insurance, and do you guys have insurance, drug insurance?
Yeah.
Okay.
No, I don't have drug
Okay.
insurance.
So if you have drug insurance, then on when you're having when you're going to see me, we will find out that whether it is covered or not. If it's not covered, then usually there is a special form, or we usually do an appeal or something to help with them. And most of the time, if we send an appeal and then you have sitting with your HR, 80% of the time, I did notice that they do get covered. Meanwhile, what I usually do is start you on a sample that usually lasts you 4 weeks, and by this time you will get an answer. The people who do not have any drug coverage, we start with a sample, and then I usually tell them kind of what amount they're looking at. Usually for most people, 1 month sample is usually I provide them, and after that is Ozempic, there's no subsidized to it. So all of these will be anywhere from $250 to $300. If we go on a maximum dose for either Saxenda or Ozempic, that can be anywhere from
Is it per month?
Per month.
To
Yes.
what you just said?
Yes, per month.
For which medication? Like
So-
you
so-
told us about three, 4.
Yeah, 3. So all of the 3 medications, they are anywhere from $250 to $300. All of them. There's not much difference.
And you have to take just one of them, right?
Yeah.
Okay.
But when it comes to Saxenda and Ozempic, the maximum dose, because usually at 1 or 2 months, you might not go on a maximum dose. By 3 months or by the end of the 2nd month, you start to hit kind of a go more, because the maximum dose is actually give you the best and maximum results and start to work on your hypothalamus set point. And that can be $500 for both. The maximum dose. So the 50% dose is usually up to 2 months. In that case, what happens is that Saxenda does give 50% off. Ozempic, there's no discount to it. But if you have a coverage, then they cover it. Okay, just give me a minute and.